have 8 or 9 medications. 9 medications or more is called polypharmacy.
We're back. We're taping.
Who was that politician, Mario?
I don't know.
From Florida, with the water. Okay, next page, lab. Laboratory is also 2 pages. There's chemistries, there's CBCs, there's others, there's therapeutic drug levels for medicines like digoxin, theophylline on there. You need to write the date. You need to write the normal value and the patient's result. What I ask of my students is, and you find this, by the way, under the tab that says laboratory, what I ask you to do is to write the abnormals, not the normals. What do you two do?
Pretty much just the abnormals.
Just the abnormals? Okay, so anyway, the 3 of us in here then would ask you, you don't have to write all of the normal ones, but if they're abnormal, please write those down. Now, where it says normal range, on any lab report, you will see the study, the patient result, and then in parentheses, you're going to see the range, okay? So that's where you capture the range from, is on that lab sheet at the facility. This needs to be written at the facility. You have to look into the lab section. You have to find which is abnormal. Sometimes they're in red. Sometimes they have H's or L's, meaning it's high or low. There's going to be something on that lab sheet that keys you right into the things that are abnormal, so you don't have to do a whole lot of searching. And find the ones that are abnormal, write the date that it was abnormal. Very important thing is what date it is that it was drawn on. Write the patient result and write what the normal values were. That has to be done at the institution. Now, the going home part is the last section. Now you're going to go home. You're going to get out your lab books. You all have that, right? Those lab books. You're going to look up that lab value. You're going to find, what does potassium mean? What does calcium mean? What happens if these things are too high or too low? And you're going to look those up in the lab books, and then you're going to think about how that's significant to the patient. All right? And again, you're going to do your best. If you can't figure it out, that's what we're here for. But I want you to try. I want you to try, and if I think that you're almost there, I'll help you get there. If I think that you're totally off base, I will help you come to the correct conclusion. But I want you to try. Don't just leave it blank and say, I don't know, I don't get it. Because I need to know that you're thinking, that you're trying to put this together. Yes, ma'am?
Just to clarify, so the parts that you're telling us that we have to do at home, we're not taking the patient's chart, but when we have part like homework for a particular patient, how are we going to remember?
You've got that paper that you've written out at the facility. You're going to take that home with you. It just doesn't have any patient identifiers on it. Okay? It doesn't have the facility that you're at. It certainly doesn't have their name. It doesn't have any kind, no medical record, no date of birth. There is no identifying information that's on that paper that you take home. Okay? You'll have a paper with a diagnosis. You'll have paper with medications on it. You'll have paper with lab results. Okay? But no identifiers to the patient. Okay? So this you can take home. And then you're going to look this up because you don't have to memorize it. You can take that paper home. That's why you're writing this piece out of the facility. Okay? Yes, sir?
Under the normal value, is that what's normal for the patient? Or what?
No, that's normal value for that lab result across the board. There are some variations between pediatric and adult, but you don't have to concern yourself with that right now. You'll probably see it in your lab book. Okay? But you're just looking at adult values. What's the name of their lab book? Their laboratory
It's an F.A. Davis product.
It's in there. It's in your
Yeah, I can't remember the-
book list. in your syllabus.
Yeah, it's in the
I
syllabus.
can't recall the exact name of the book, but it's
Here.
a lab.
I could get my phone and show you.
I'm sorry, what is it?
Yeah.
Okay, so it's in the syllabus, that's what
Yeah.
you're reading from?
It's
Yeah.
it's laboratory and diagnostic tests with nursing implications, 5th edition. Van Leeuwen is the first author. It's an F.A. Davis book. We
Okay.
like that one better.
You need these things now. I mean, from now on, you really need these reference books. You really, really do. Okay? I mean, I've had them all my life, yes.
So under the normal value, will we have something in every box or only for the ones that were abnormal for the patient?
You're only writing down the abnormal, and for everyone you write down, you have to give me
The normal.
what the norms were,
Okay.
okay, and what the patient was.
So not every box will be filled out for the normals.
You mean all these boxes here? No,
Well-
if the patient's sodium is normal, there won't be anything written there.
Okay.
Yeah. Okay? Separate, those are reference books, right? Yeah.
I think it's relatively inexpensive from what I found.
You know, some people today with these iPhones, they've got stuff like that loaded into their phone. Boy, I live and die by my Davis Drug Guide that's on my phone because every semester I have students that are passing meds and they throw something at me I've never heard of, and I got a really quick look, you know, so. Any question about lab? The abnormals, unless your clinical teacher says they want you to write all of them, and again, they can, that's their academic freedom, but I choose in mine to have you write the abnormals because I want you to really look to see if this is the medical diagnosis and they're on these medicines, does it stand to reason this lab work would be abnormal? That's thinking like a nurse, and we got to get you there, guys, and this is how we do it, okay? Okay. This is chemistries. We can go on down to, there's CBCs here, platelets, coags, drug therapeutic levels. These are drugs that have a very narrow therapeutic range. You remember that in Intro to Pharm? The therapeutic range can be very tight. Okay, these are some of the drugs that have that. So you have to do drug levels on that. There's some more lab. Look, we got culture results, urinalysis results, x-rays, CT scans, MRIs, and ultrasounds. Let me give you a heads up about those studies. X-rays, CT scans, MRIs, and ultrasounds. It's gonna go, cardiac silhouette. Then you're gonna see impression, okay? Or you're gonna see findings. Whichever one they want to use. I've seen them both. That's what you want to write down. And I'll let you plagiarize that part. You can write it right from there because you're not going to have any idea what it means. But I don't want to see that the cardiac silhouette is that. I mean, because the radiologist is reading all this stuff and he or she's saying what they find. But what's important to us is the impression. And that is, do they have cardiomegaly? Which is an enlarged heart, okay? Going back to the guy with the MI, who might have some heart failure, might I see cardiomegaly? Yes, an enlarged heart because it's failing, right? It's just having to pump so hard that it enlarges, and that's not a good thing, okay? So you're wanting to find the part for any of these studies that says impression or findings, and that's what you want to write there. And then, of course, you're going to go home and look those studies up, and you're going to try to figure out, well, why with this patient, with this diagnosis, am I seeing this on an X-ray? Do you see why this carries the most points for your clinical? Okay. Okay. And we want this all done at the end of your first day. Just kidding. You will. Sure. That's going to happen. All right. And you say, well, you bumped your head if you didn't going to get this done in one day. All right, here's your physical assessment data. Now I want you to look at this sheet because what we plan on in block 1, we prayed for, is that all of you have just one patient for the rotation. With that said, I could bring former students in here that said, yeah, I had a new one about every 2 weeks. Okay? We try very hard in block 1 just to give you one patient because you need to build up your confidence. You need to learn what you're doing. Some of you have never put your hands on a stranger in your life, and all of this is going to be so new to you. So I would rather you get comfortable with one person. And so that's what we try for. So that means that you're really only going to have to write one care plan out. All right? How we modify that if you change patients in midstream, you will be directed individually and specifically by your clinical instructor as to what they want you to do in that case. But what we want to see is one beautiful and complete care plan. Once everything that I've shown you previous to this is done, it's done and it's wonderful, and your teacher has said this is like really awesome. Your care plan, that piece of it is what? This could never go on YouTube. You got to know this.
It's going.
All right. What was I saying? You got me all flustered, yes. All right, so that is all complete, all right? And then that's good. And then the only thing you have to do after that is every week that you come in, you have to look at the patient's chart to see if the physician has made rounds over the last week and change any orders, right? You have to make notes. So this piece is a living, breathing document. You have to know if any medicine has been changed, added, discontinued. Has there been lab work that came in over the week? So what you need to do then is once you get this care plan piece that we just talked about together, your work isn't over. You still have to update it and change it and alter it as the weeks go on. Does that make sense? Okay. So now we're going to go on to the physical assessment data. This is something you're going to do every week. And so we need one for every day that you are in clinical. Some of your teachers might not have you do it on the first day because you're doing your scavenger hunts and you're learning how to get on the computer and you're really not addressing your patient a lot to be able to do it. But when you look at this, does it not look like what you heard yesterday in lab under physical assessment, that head-to-toe thing? Is this it? Absolutely. So this is what you do. Do you remember we told you that you have to do a head-to-toe physical assessment on your patient each and every time you go to clinical? Well, you're going to document it on this. And that's what this paper is for. And if you question any of this under here, you can always look back at Professor Gray's lecture on Module 4 about a head-to-toe physical assessment, because that's where you're going to put it, and that's why we need a new one of these every week. A new one of these every week. Can you do this at the facility? You betcha. Because you're doing the assessment, you do the documentation. Yes? Okay. All right, this is a critical thinking question. You're going to do this every week too. This piece you're doing at home. This one you do at home, and we need a new one every week. This was actually developed by a nursing theorist called Linda Caputi, and we do like her work. She's actually, she's a national speaker, international speaker, and she's come here and spoken with us at Maricopa as well. And this is what she says you need to guide the students to be able to do, to think critically. So when you go home after taking care of this one patient all day, we want you to stop and think. List some possible nursing diagnosis for this patient. We're going to get into what that is in a minute. What are you on the alert for today? So that today would be when you come back to clinical, okay? What are you going to be on the alert? What are you going to be watching for? Now that you know what the diagnosis is, you know what medicine they're on, you know what lab work they're showing, you know what their nursing diagnosis is, what are you going to look for based on all that information? I'm sorry? Well, it's more like, what are you going to monitor for? What are you looking for? Okay, what could possibly happen when you walk into the room? Let me tell you guys, when any nurse that you see on the floor in a hospital, in a nursing home, walks into a patient's room, there's a myriad of things going on in their head. You just can't see it, okay? You have no idea what that is. But what they're doing when they walk into that room is they're critically thinking, this patient has this problem. I need to see if they have this going on, that going on, this going on. And it's all this process from years of nursing and the experience they have that goes through their mind. This is getting you to be able to start thinking like that. That's what this whole thing is for. So what do you, based on this, all right, say the calcium level is low. I know that low calcium levels can cause seizures. Maybe I'm on the alert for the fact that, oh my gosh, his sodium level's 100, his calcium level's 116. What if he's going to have seizures? Okay.
I'm breaking.